think if we talk about, there's obviously physical factors and then psychological factors. So I think in terms of physical factors, the best people are going to be the people who have symptoms from their breasts apart from just the size. And those symptoms are going to be shoulder ache, shoulder pain, neck pain, rashes under the breast, people who have lower back pain, people who want to be able to wear certain clothes. A lot of the time, clothes that fit a certain bust size are too billowy elsewhere, for example. So, and obviously people want to do more physical exercise. So I think for those people, it's ideal. It's ideal for, from a physical point of view, to be at a certain weight as well. So if someone is in the process of losing weight, then it would be ideal to reach a stable goal weight before considering something like that. There is a group of women who are quite young, so in their 20s, or who haven't had kids basically, who have disproportionately large breasts. And so for those women, it's not as ideal because there are potential issues with breastfeeding and with nipple sensation and with recurrence. So if you're in your 20s and you have a certain size, and then when you hit your 50s or something, you might change your overall weight, which can then change the size of your breasts. That can mean that a breast reduction that you had in your 20s is now large again down the track, so you might have to have it done again. So certainly, for some people in that early age group, it's a bit more, got a bit more cautious, be a bit better informed about the pros and cons of something like that. But still, there are plenty of women who are young, who get a huge benefit from breast reduction surgery. But certainly the ones who have really bad symptoms with their neck and their shoulders and their back, that's probably the ideal. From a psychological point of view, I guess it's again going back to someone who's well informed and who has realistic expectations. Nipple sensation can be increased or decreased. So, and I normally say to patients, if nipple sensation is really crucial to you, then any sort of breast surgery can alter that. So, and certainly breast reduction surgery is certainly one of those. Usually the scars for breast reduction surgery are long. They're hard to see once they're faded and matured and healed in properly, but that can take 12 months. So someone has to have, significant enough symptoms from their large breasts to be happy to have scars on the front of their breasts, which admittedly are really hard to see. But if you're under fluoro lighting, standing in front of a mirror, you can see them.